Good morning. I'm Bob Ravenscroft, the Vice President for Advancement at Bryan Health, here for, the June 1 media briefing. With me today is John Woodrich, the Chief Executive Officer of Bryan Medical Center. Before we get going, I think we'd be remiss not to mention some of the activities of this past weekend. First of all, what a trying weekend for law enforcement, but the Lincoln Police Department was nothing but cooperative with us, alerting us to what was going on, and in their planning, certainly keeping infrastructure like the hospital safe was one of their primary things, so thank you. To the peaceful protesters, we had a discussion this morning in the senior leadership team. Geez, it's sad, it's maddening, we empathize with you. But for the peaceful protesters, there was also a lot of inspiration and messages of hope, and we're committed to doing anything we can to participate in advancing our community forward from this. And I'd like to mention for the peaceful protesters, from the footage that we saw, thank you. The vast majority were masking, and that is important because despite the upheaval and civil disobedience that is justified, we are in a pandemic, so seeing all of those masks was very gratifying. Also to the volunteers that helped clean up our city, we saw the generosity of this community over the past months responding to us. It was sure extended to the rest of the community. And then lastly, to the local media. We were consuming everything you guys were putting out. It was absolutely fantastic. And then late in the evening, certainly the work by the Journal Star and their live screening talk about riveting left little to the imagination of what was really going on, and we certainly respect your work, and it was fascinating. Back to the pandemic. It's still going on. We have now administered 9,551 tests at Bryan. Our positives are now sadly 1,290, and we have 429 results pending. Our midnight census was 377 to start the week. With that, I'll turn it over to John, and then we'll open it up to any questions you might have.
Thank you, Bob. I always like to share with you the percent positive number, and this is excluding our mobile clinic. We're at about 13.4% for all of the drive-through hospital and urgent care together. We do have 24 positive COVID patients in-house, 17 from Lancaster County, 7 from outside the county, and just 1 individual pending. 9 individuals on vents, 10 in our intensive care unit, 6 in our progressive care unit, and 8 in our general care unit. So if you think about the numbers from last week, we're staying pretty steady from an inpatient perspective. I did want to share with you, and I know Bob mentioned this last week as well. So today was the first day of our support person or visitor person with our patients, and that started at 5 a.m., and that's from 5 until noon. So we're trying to still limit the number of individuals that come into our organization, but we want to be sensitive to those patients and allow them to have a person that they need to help communicate discharge orders or instructions or help communicate. And they know the individual better than we do, so it's really helpful to have those individuals there. So we're glad to be able to offer that once again. And then today was also the day where we increased our elective surgeries to what we call phase 3. So we'll be sharing with you throughout the week how that's impacted the organization. But I think you've heard from Bob's numbers today that also our inpatient census is at 377, so has come down from last week as well. With that, we'll go ahead and take any questions via chat.
Yeah, absolutely. I think it probably depended on some of the photos you were looking at. There were a fair amount of the peaceful protesters actually wearing masks, which heartened us. But you also saw the pictures of folks not doing it. From a health perspective, absolutely, it's concerning. Yeah, it's just absolutely concerning. You can understand why people stood up and went out there. But from a personal health perspective, it'll be something that we'll obviously have to watch over the next few weeks and through the summer as gatherings like this continue.
We had some individuals enter our facility. Again, none of them was what we would classify as trauma, but injured individuals as part of the protest. You know, thing I like to mention is that, as Bob stated, having the ability to work with our local police department and our caregivers here, we're able to take care of this when things get a little bit out of hand. But we are supportive of people that are able to get out there and speak their mind and be able to represent different individuals within our community. And we hope that they continue to remain peaceful in that. But we also know that at times we'll have some individuals get a little bit over the top. And we are supportive of the individuals, and we are saddened by what has occurred, just like everybody else is in this area as well as across the country. We had a little over 90 individuals scheduled for that day. We actually had 25 no-shows, so we had a little bit over, up in the higher 60s, have their testing done. We did have those tests done and administered by Bryan, but they were resulted into the state lab, so I do not have those results at this point in time. I did meet with the health department this morning, and as of early this morning, they hadn't received those results back.
I don't know the specifics. I know they didn't qualify as what we would call trauma or life-threatening, so one can only presume it was contusions, some lacerations. Who knows what it was, but uncommon circumstances, but routine things for what came into an emergency department.